We try to look at past pandemics and maybe learn from those. And some of those have good lessons for them. Some of them we may think, well, like H1N1, was it really that bad? We thought it was going to be that bad, and then it ended up not being. Now, we also had a vaccine that was introduced during that time, and so there were worse deaths from H1N1, but it got halted and then turned out not to be as bad as maybe we anticipated. We have to look back, I think, further than what's in a lot of our memories. If you look at the experiences from the Spanish flu, 1917, 1918, there's some good examples there where some cities quarantined people or told people to stay home, and one city had a big parade, and then it was followed, that city, by a huge number of deaths. Whereas the other cities that told people to go home, they lessened the mortality, the number of deaths. Some people, there's a few people who remember polio, and there were nationwide quarantines when polio would be circulating, and there are people who remember that. There's two things. One is that we're all susceptible. We haven't seen this before, we don't have that immune memory, and so if we get exposed, we're going to get it. The second thing is that people are contagious a long time before they show symptoms. And some people never show symptoms and are contagious. So most things you start to feel bad, you know you're getting sick, you go home and you don't expose everyone because you know you're sick. But maybe you've been contagious for 3, 4, 5 days before you start to feel ill, and that's what's different. So we're trying with the science that we have to look at this and manage this. I like the analogy of World War II. People did their civic duty. They rationed, they had blackout times. It wasn't optional. It wasn't like, oh, I don't believe in that, I'm not going to do that. No, everyone participated and everyone did their civic good. I don't think this is going to last as long as World War II, but I think the idea is that we all have to do our duty because we want to flatten that curve.